Okay. Good morning. We're here with Dr. Russ, Green Valley Veterinary Services, and we're talking about pets, mainly dogs today. Dr. Russ, why is it so important for dogs to be checked, have a vet check them?
It's good to have your dog checked at least once a year. As dogs get older, what we try to stress is maybe 2 times a year, sometimes 3 times a year as they get even older, because what happens with a routine exam is we can pick up on a few things before they get really bad, and we can start dealing with some of the issues that the older dogs have, the arthritis, the renal kidney issues, the liver issues, and things like that. And just by doing a generalized exam, we can look at these animals and say, well, this is something that needs to be addressed. We need to look at the teeth. Say, do we have any dental problems? As dogs get older, just like humans, you need to look at the teeth and say, well, we've got some calculus and some tartar buildup, so maybe we need to do a teeth cleaning to break that down so they don't have an extreme gingivitis. It gets in the bloodstream, causes problems in the heart, things like that. So just a general overall exam. You can pick up on some lipomas, some fatty tumors, things like that. So just a good overall exam on a young dog once a year. Doing it during vaccination time. An older dog, maybe twice a year. As they get older, I like to suggest pulling blood work at least once a year on an older dog, usually after 7 years of age, just to get some baseline values. And so if we do it when they're 7, that's when the dog is starting to get into their older years like we are. We have some baseline values, so if they're 10 and we pull blood on a routine situation, on that once a year exam, and we pull some blood, and there's a big difference between the 10-year-old and the 7-year-old, we can say, well, we got some problems here we need to address before they get too bad, and we can't make significant changes in their dog's health.
Okay, and this is Maya, and she's 3 years old, and she was just checked last week by Dr. Russ. And Dr. Russ, can you give us an example of a few things that you look for in a 3-year-old dog?
Sure. So when we start out, what we do is we go through the full exam. So everybody has their way of doing their own exams. I like to start from at the head and basically I look at the dog's eyes, see if there's any problems, make sure everything's going well. I look at their teeth, make sure the gums are looking good, not excessive tartar buildup. From there, I'm going to go down and I'm going to palpate underneath here, feel some lymph nodes, and make sure there's nothing swollen. At that point, I'm going to look at the ears, make sure that there's nothing going on inside the ears. We use an instrument called an otoscope to look in there. We can look externally, and then the otoscope lets us look deeper to make sure that we haven't have any otitis externa or external ear infection going on there. We did that on her the other day, so I don't want to subject her to that again. At that point, the next thing I do is put my hands on the dog, start feeling the dog, see if there's anything going on. At that point, the next thing I would do is listen to the heart, make sure the heart sounds normal. Is it beating normal? Do we have any arrhythmias? Do we have any murmurs? At that point, I'm going to move from the heart. Excuse me, I'm going to come back to the lungs, listen to the lungs. Are they clear? Are they good sounds both sides? Any issues going on there? At that point, I'm going to ask her to stand up, and I'm going to do an abdominal palpation. So I'm going to feel the abdomen. Does it feel normal? Do I feel an extended bladder? Do I feel anything in there that's lumpy, bumpy, something that shouldn't be there? At that point in time, I'm going to go down. I'm going to feel the femoral pulse. Does it feel normal? Is it thready? Is it pulsy? Is it normal compared to what the heart rate was? Excuse me. At that point in time, I usually look underneath their tail. Everything feel good there. Feel the anal glands. Are they impacted? Are they full? Do they need to be expressed? And lastly, what I normally do is check knees. Especially on the smaller dogs, the toy breed dogs, tend to have problems with laterally or medially luxating patellas, so I usually check them and make sure they're firmly in place and there's no luxation. Usually your clients will tell you they've had a dog limping when you feel that, but I still like to feel them just to make sure. So basically we start at the head, we move through all the way to the back end, move through all the body systems and just look everything over. A lot of times, as dogs, summertime comes on or spring or summertime comes on, more part the hair. Look at the skin coat, does it look normal? Do I see fleas? Look at the back end, you're usually going to see fleas congregate around the tail head. So you look at the skin area back in there, and do I have any flea problems? So that kind of takes you through the whole body system, front to back.
Okay.
Lets you look at everything and make sure everything's kind of normal.